Up first this evening, the country recorded its first coronavirus-related death today. The details were provided at the daily press briefing at Jamaica House this afternoon. Vashon Brown was there and now joins us live in studio. Vashon.
Thank you so much, Herman. Well, the Health Ministry was awaiting the results for 11 tests, and they received those results today. 2 of the test results came back positive for COVID-19. That essentially means that Jamaica now has 15 confirmed cases of the virus. Now, one of the new cases is linked to patient 1, the first person confirmed with COVID-19. The second patient, with a travel history from New York, died today. The Chief Medical Officer gave additional information at a press conference today.
This is a 79-year-old male from Clarendon with a travel history from New York. He is known to have diabetes and hypertension. He presented to the Lioneltown Hospital on the 16th of March with fever, cough, and shortness of breath. And that time he was noted to be critically ill and was transferred to the Mandeville Public General Hospital, where he was isolated and treated. The patient had shown some improvement yesterday, March 17th, but today his condition started to deteriorate. His test came back positive today for COVID-19. He continued to deteriorate today, and during the process of transferring him to the University Hospital of the West Indies, before he was able to leave the Mandeville Public General Hospital, he demised at approximately 3 p.m.
Now, Dr. Bixesa Mackenzie says the family has since been informed, and the public health team is currently on the ground both at the patient's home and at the hospital. Now, as for the 14 other persons who tested positive for COVID-19, the CMO gave an update on their condition.
As of this morning, for the 14 persons that are under treatment, now we have 13 persons that are stable and are doing well. 3 are totally asymptomatic now, and we will start their discharge testing shortly. We have 1 person that has been in our care for about, I think, 5 days, and that person has some chronic illnesses and is showing some symptoms still. And there is a little, this morning when we spoke to the team on the ground, they said that the person was, not critically ill, but still ill.
Now, as you know, sections of Bull Bay and St. Andrew are under quarantine. Permanent Secretary in the Health Ministry, Dunson Brand, today defended the importance of the measure.
The reason why we put quarantining into place is to protect you and to protect the entire society. And therefore, it's self-compliance and self-regulation that we are trying to encourage, a behavior change, because we are going through the crisis together. If we had not put those restrictions in place, what could have occurred if those positive cases that we have now identified from our first case was able to move throughout the community and the wider Jamaica? Just think of the impact of that and realize that because we acted early and because we acted swiftly, we were able to contain any further spread.
Now, 25 people are in government facilities for quarantine, 28 now in isolation in health facilities. The ministry says it is currently awaiting 6 other test results. I mentioned earlier that one of the positive test results is linked to patient 1. That means that 5 of the confirmed COVID-19 cases are linked to that particular patient. The ministry is also doing contact tracing across different parishes. A total of 434 persons are currently being traced. Of that number, 224 are from Kingston and St. Andrew. The Chief Medical Officer says these persons are being followed on a regular basis to determine whether they have any symptoms. 32 symptomatic contacts have been identified, and the Health Ministry says some of them are in isolation facilities.